Welcome everyone. We'll just give it one more minute so people that are still trying to log in are able to. My name's Sulo Kalendrin and I'll be running through the Workspace webinar, Aged Care. I know I've come on a couple of minutes late. We've had some technical challenges, but we've overcome them this morning. So just bear with us. All right, it's 11:04. Thank you for your patience in getting these slides up and waiting for us. So I'll get started. I'm hoping all of you can hear me. If there's any issues, please reach out and I will try to get back to any questions later on. So let's just get started. Today's Workspace webinar was going to be run by Kelly and myself. Unfortunately, Kelly's unable to make it due to some of the technical difficulties we've been facing this morning, but this is my area, so we can get started. Let's start off with the acknowledgement. BDO acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples. Thank you. Now, a bit of housekeeping. Please submit any questions that you have in the questions tab, which you can see in this screen here. The orange one there will be muted. Any technical difficulties that we have, feel free to click on the support button or visit that link there. In terms of following up, after the end of the webinar, we'll provide you with the presentation slides. There is a lot of content in today's presentation, so if there's any questions, please reach out to myself or Kelly. There'll be a link to the webinar recording. You'll also have access to all the other webinars in the Workspace series. And you've got Kelly's and my contact details, which I'll show you on screen in a second. All right, so it's just myself today, as I mentioned earlier, Sulo Kalendrin, Wealth Advisor at BDO Private Wealth. Now, prior to joining BDO about 12 months ago, I've had a long history in the aged care advice space. It is in the residential aged care space rather than the other topics we'll touch on today, but it's important to understand the realm of what help people are able to access. So we will go through that today. All right, so the agenda. Getting started today, we've got aged care, and I'll go through the levels of care with you today. That includes the Commonwealth Home Support Program, the home care system as it is currently set up. There's been some minor changes along the way, getting ready for Support at Home, which is a new home care program that's being rolled out, which is going to be rolled out on the 1st of November 2025 now. The date was pushed out from the 1st of July. We'll then run through residential aged care, the current system, and then we'll also run through the reforms that are upcoming come 1 November. Again, both of these programs have been pushed out to the 1st of November, really to help the providers and get the providers and their systems be ready when those reforms are in force. Aging care. Let's look through the levels of care. So we're very lucky in Australia to have government subsidised aged care, and the system actually provides for varying needs. So from an entry-level perspective, you do have the Commonwealth Home Support Program. which is the in-home support program that really helps elderly people to live independently in their homes and their communities for as long as they can. They provide respite services to give the carers a break as well, because as some or all of you may have come across, the carers tend to take on quite a large weight when they're caring for someone as they age. When individuals need a little bit further assistance, it might be more than just the basic requirements that they've been getting some assistance with, they can also apply for a home care package. That will provide individualised support to help people stay at home for longer and delay their entry into residential aged care. Ideally, the idea of this entire system reform is to assist people in staying at home longer and surrounded by their loved ones and surrounded by their familiar surroundings. Residential aged care, that's when they have further care needs, and we'll go through the residential aged care, the current system and the new system in a bit of detail later today. So the Commonwealth Home Support Program, what it does is it provides entry-level support, as I said. So services such as a bit of help around the house, transport, where it may be I need to go to the doctors, I do need someone to assist me in getting there. It might be meal preparation. I'm not as confident picking up my pots and pans anymore. I seem to forget to turn the stove off sometimes. Maybe it's time that I just get a little bit of help around the house, but I do want to stay at home longer. So that's for the very entry level and getting ready to be comfortable with asking for assistance. You can get nursing help, there's social support, you can get some planned respite care in using this entry-level support as well. To be eligible, you need to be living independently and are either over the age of 65 and finding that they do need further assistance, or 50 or over for Aboriginal and Torres Strait Islander peoples and have functional limitations. And there's just some tweaks and rules around it once they're over the age of 50 or older than 45 for Aboriginal and Torres Strait Islander peoples on a low income. So the way to apply for an assessment and to see whether you are eligible in the first instance is to contact My Aged Care. And the links are there provided to you. I probably should have put a phone number in there, but I haven't, but it's really just the My Aged Care Contact Centre. When an individual contacts them, they will do a screening. So they will say, what's your situation? What's your eligibility in terms of age? And then what's your need? What are you really looking for? If the individual on the phone says, oh, I'm just looking for some very basic assistance, they will be screened and directed towards the Commonwealth Home Support Program. If they say, actually, I'm looking for assistance and seeing whether I will be eligible for a higher level of care, but maybe potentially a home care package, then an assessor will assess you accordingly to see whether you are eligible for that home care package. So let's go through that. In terms of fees, Commonwealth Home Support Program providers receive government funding through grant agreements. So what that means is they can provide subsidised services to older Australians. Clients will pay a contribution or fee towards the cost of care. And if they can afford to do so, they will contribute. If they can't afford to do so, they're not going to be excluded. They'll not be asked to cover the full cost of the service, and any fees have to be agreed with the client themselves and the service provider before they get started. So it's almost an entry-level way to understand how the system works and how the service provider and the client can get to know each other for the levels of services that they will provide. Generally, it's one provider that will provide many services. And if you want to go and choose your own service provider, you'll have to have that discussion with the service provider themselves. And I'm not an expert in that area. Now let's go through the current home care system. As you know, there are home care packages that provide care as well as services. What that can assist with is some help around the home. So if your aging parents are saying, maybe I'll take some help around the house, and they will push back for as long as they can, and then they may have a fall or something might alert them to maybe it's time to get some help. It's time to get some aids and equipment like walking frames, bathrooms to be fitted out correctly. It could be home modifications if needed. It could be a bit of personal care, nursing, some physiotherapy, some social assistance. So home care really is that next level that people can step up to and say, I need some further help. What can I access? In terms of eligibility, again, generally over the age of 65, over 50s for First Nations people, where they can coordinate services to help them stay at home for longer. There are ways that a younger person with a disability or dementia or further care needs can access specialist services. Now, with home care, there will be, current system says, we need to provide an income assessment. We need to arrive at an income assessment. And what that means is they'll request all the income details from the individual and work out how much they can contribute. That's called an income tested fee. So I'll just run through the packages and the fees. So currently there are 4 packages. Level 1 is your basic level of care. Level 2 is the low level of care, intermediate, and by the time someone is a high level care home package recipient, they're at level 4. There's your daily amounts that's been provided, but from an annual perspective, if you move your eyes to the right of the screen, fortnightly and annual government contributions have been listed there. So these are current as at 1 July, and they do get updated every year at that time, at July. So level 1, there's about 11,000 that could come through. Level 2, a subsidised package of about 19,000. Level 3, about 41,000, and level 4, 63,000. Now, just from a little bit of insight as to how do people access this, again, it's just My Aged Care. Someone asks them for a home care package, they will be screened to check eligibility. Then what will happen is an individual will be contacted by an assessor to either meet with them face-to-face or do a phone assessment. I always recommend that people try to meet people face-to-face because it's hard to tell someone over the phone what the care needs are. Whereas if the assessor comes out to a home, you can see the dishes, you can see the state of the home, and they can make a general assessment that is probably more accurate than what they would be provided if they did it at home. But also it comes down to funding levels that have been received and how many assessors are there depending on the area that you're in. Now, if you do start off with a basic care level for a couple of years and you're doing well, you don't need further help, but in that 3rd year you think, oh, it's time, your family and friends are telling you you need a little bit of extra care, and it's time to potentially call My Aged Care again and say, I need to be reassessed. Generally, what will happen is when you receive a home care package, you'll have a service provider that you choose, and they will provide all the services to you. It might be gardening, it might be the cleaner, it might be the nursing. They will also be responsible, ideally, to say, I believe you need further care, and they may request for you to apply for that next package, level 2 or level 3. Now, once you have a package, you'll be assessed, then you will eventually be approved for the package, And then you're basically in a waiting line until that approved package becomes available to be allocated to you as that individual who needs care. So there is quite, at the moment, there's a long wait time. And I heard yesterday that it could be, I think it was level 2 packages can be up to 9 weeks wait time. But the reality from what I hear from families that I assist with in the residential care space is that they were waiting for a package for so long, they didn't receive the help, and now they need further care. So the government's very much aware of this issue and this problem and this limitation. That's why they've come up with these new home care packages to replace the current program. So just one more time in terms of how to access the program, you'd access it with My Aged Care. I have put in the number on this slide, so note it down please and provide it to potential families that may be able to gain some assistance through the programs. You'll be referred for an assessment to check your eligibility, then you'll be assigned a package, and eventually you'll be approved and allocated that package. There is a lot of demand, as you may have heard already. So the sooner people start to move into this system, the sooner they will be getting their help. So unfortunately, the worst part of it is the reality is that people will actually come to the aged care, My Aged Care site when it's almost too late. They've had to go into hospital and then they've come home. That's really hard for them to make changes in the home and how they've been operating in the home. So encourage people to access these programs as early as possible once they are eligible. That's what it's there for. The idea here is we want people to stay at home longer and enjoy their families, enjoy their surroundings as long as possible. Now, there are basic fees. So in terms of the fees, when you are in, sorry, I've got a meeting coming through, apologies. Okay, so from a home care package, there are 3 types of fees that you would pay towards that home care package. As a recipient of the home care, you would pay the basic daily fee. So level 1, if you're approved for a level 1 package, there's a daily fee of about $11 to $12. And as you increase your package level, so does that daily fee. So it's about $13 a day for level 4 package recipients. It is updated in March and it's updated in September each year in line with the age pension. So it's really set as a percentage of the single basic rate of age pension. The next fee, as I mentioned earlier, there's an income tested fee. So what that is if you've got income over a certain amount, and this part is assessed by Services Australia on the home care forms, a full pensioner with income up to about $34,000 does not need to pay an income tested fee. But above this amount, once you run the incomes through a formula, the maximum someone would be asked to pay is about $37.70. So for the lifetime, there's a cap applied from 1 July. The cap is $82,347. So once someone is in the home care system, if they're required to pay the basic daily care fee, everyone pays. But if they're required to pay the income tested fee, then the income tested fee will be capped at $82,000. Now, say this particular home care package recipient is having to pay an income tested fee. That particular income tested fee is going to be counted if they move into residential aged care. If they move into residential aged care, that particular fee will be counted towards their lifetime caps. Currently, the means tested care fee lifetime caps. So we'll go through that later on. And the third fee they'll pay is the additional care services. So if they want more services than their package is actually funding, they will need to pay and contribute towards that. So the reality is some home care service providers don't charge the basic daily care fee, and that was the case a little while ago. At the moment, with the systems about to change, I would assume they will be starting to charge that basic daily care fee across the board. So have those discussions, understand the fees you're paying before you sign the agreements. Okay, now moving into what we know of that's coming through in November 2025, which is known as the Support at Home program offering. So the new Support at Home program starts 1 November 2025. There's a lot of words on that slide, so apologies in advance, but I'll try run through it. So it's going to replace the old system. So old system drops off, new system comes in. It's been designed so that there's improved access to services, improved access to products, home modifications so people can remain at home healthy, active, socially connected, and really helping them be surrounded in their own environments for as long as possible. So for full and part pensioners, the support at home contributions will be determined by no longer an income test assessment, but by an age pension income and assets assessment, what we refer to as the means test. So this is a change from moving away from just an income test for the income tested fee over to an income and assets assessment. Non-pensioners will need to provide information about their income to Services Australia so that they can actually provide their contribution rate as it's assessed once it goes through the formulas. Anyone who doesn't provide this will be assessed as what we refer to as means not disclosed, and they will end up paying the highest rates. So please encourage everyone, no matter what their availability of income and assets is, please refer them to Services Australia to fill in those forms. Ideally, have their family assist them through the process. Family, or if they don't have family, it would be a friend or a trusted person in their lives. Okay, in summary, the current system says you pay a basic daily care fee or basic daily fee. Only your income is considered when calculating how much you're going to contribute towards the package. If you've got certain means, you pay an income tested fee. So that's the way the current system is going to work, and that's going to work up until November. And once the new system comes through, 1st of November, you'll actually only pay for the services you use. So the contribution will be based on the age pension means test, which considers both your assets and your income, runs it through the formula, and then you will be asked to contribute a certain amount based on that. So when I say you'll only pay for services you use, from what we know so far, the contribution is based on two factors. The type of service, so there's no contribution towards clinical support services. So that's the big change that we've seen throughout these reforms, is there's no contribution for clinical support services. There'll be a moderate contribution for independence services such as personal care, products and equipment, assistive technology and home modifications. That will need to be researched further. It's not my level of expertise is not in this area, but just giving you as much information as I do have up my sleeve. So you'll make a higher contribution for everyday living services. So everyday living is your gardening, your assistance with cleaning. So in those areas, you'll actually pay a higher contribution for those particular services. So it's a type of service that's actually being asked for. And then the secondary part of that is the financial situation. So based on your financial circumstances, based on your income and assets, you will pay a contribution towards the service that you're asking for. Full pensioners, they will make the lowest contribution. Self-funded retirees who are not eligible for that Commonwealth Seniors Health Card will make the highest contribution. That just means their income is a lot higher. Now, the proposed changes, the new Support at Home program, there'll be 8 ongoing package levels, 2 short-term package levels, with the highest package exceeding the current level 4 budget. So you're getting more funding, more subsidised funding. Clinical care, once again, the clinical part of it is going to be government funded. People will pay a portion of independent support costs and everyday living costs, as we talked about. So there's a bit of a formula around that. So full pensioners will pay 5% of the costs and 17.5% of the everyday living costs. Self-funded retirees will pay 50% of independence support costs and 80% of everyday living costs. Anyone between those levels will need to assess them and see where they fit. Anyone who does have a Commonwealth Seniors Healthcare Card will be assessed under the self-funded rules unless they choose to give Services Australia all their financial information. For various reasons, some people don't like to involve Services Australia in their financial affairs, but in this case they are encouraged to do so they don't have to pay a higher amount of fees than necessary. Concessional rates, 0 to 25%, will apply to anyone who was approved or receiving a home care package as at September 24, just to make sure that no one who moves into these new rules are any worse off. So the idea is if you're receiving a home care package today, it's okay. There's going to be no further changes because we're going to make sure that the new system doesn't put those individuals in receipt of a home care package in any worse position. There's a lifetime cap for client contributions, about 130,000, and it does count towards the new residential care cap that's coming through from the 1st of November. Package budgets will be released quarterly, and you've got to use it. If you don't use it, you lose it. So that it's you don't just hang on to it and hope that you will end up spending it. Unspent funds at the end of each quarter will be rolled over into the new into the next quarter. Let's talk through the no worse off principle. So for this program, we want to make sure and give certainty to people who are already in the aged care system or in receipt of the home care package, that they're receiving a home care package, or if they're on the priority system or the wait list, or they're even being assessed as eligible but not quite in receipt of, they will be no worse off under Support at Home, which is the new program. They'll make the same contributions or lower than the new system under their current home care packages program. So if you've got people in that situation and family members that you want to assist, ask them to give a call to their service provider and see what they can understand about that if they're worried. Otherwise, call My Aged Care. And the My Aged Care website looks a lot better than it did 6 months ago. So there's a lot of information in there that you can access. If you've been assessed as not having to pay an income tested fee, note that you won't be asked to pay an income tested fee under the new system. If you're currently paying an income tested fee, you'll make contributions towards the Support at Home program, but at lower rates. If you move into an aged care home any time in future, you'll be subject to the current residential aged care means testing arrangements unless it's after the 1st of November. So for those that are considering moving into a residential care home and their needs have increased at a higher rate and they do need that further assistance and that full-time care, the current residential aged care system, which we'll talk about next, is where they will fall into. If they move in after the 1st of November, the residents that move in under the current rules will stay in the current rules and they will be grandfathered, those rules. Anyone who moves in after the 1st of November, they'll be subject to the new payment arrangements. Let me take a breather. Now let's go into residential aged care. So residential aged care is complex in itself. We always recommend to do your own research, but don't make any decisions before getting some professional financial advice. Unfortunately, it's a very complex system, but we can simplify it for you. So let's go through the residential aged care process. So initial instance, you contact My Aged Care and you will be assessed to move into residential care, and then they'll say for the eligibility, then they'll say, okay, now you need an ACAT assessor to come out to your homes, and then they will provide an assessment. What you will eventually receive as a potential resident looking to move into residential aged care is a respite code and a permanent code. Make sure when you're getting those codes and being assessed, you request for the respite code, which is really temporary accommodation in a residential care home, and a permanent code, which allows the potential resident, to move in as a permanent entrant into residential aged care. Now, my insights and the stories that I've heard is that the wait times can be quite long. However, if someone has a fall and they're in hospital, that is the best time to push for an ACAT assessment. Get those social workers who understand aged care to assist you, and they are doing the best they can to find care homes and to find available beds these days. Understand whether the resident is going to be a concessional or government-supported accommodation payer or a market payer when it comes to the accommodation cost. So that's a large concern of every family who's looking to place a loved one into care, let alone for those that are doing it for themselves and moving into residential care and really unsure, is the government going to support me, or am I going to have to find the funds to pay the cost of the accommodation and the cost of the fees? So today we will go through that. We will understand the fees that are relevant to be paid in the current residential aged care system. Later on, we'll go through the new system as well, and understand your options. So what can I do? What am I going to do with the home? How am I going to fund it? How much money should I put towards the RAD? Do I have enough funds left over so I can fund other care costs? What if I've got someone living at home? I need to make sure I leave enough funds for them. So there's a lot of questions that surround this transition into residential aged care, and that's where the social workers will assist, financial advisors will assist, and your accountant will be able to assist if required. But look, you've got my contact details. Please reach out if you need. So let's talk through, okay, am I going to be government funded or government supported because I have low means, meaning my asset and income levels are lower than a particular threshold, or am I going to be a market payer? So on the date of entry into a facility, a resident's means tested amount, which is their assets, their income pumped through a formula, and that's actually compared to what we call the maximum accommodation supplement. So that's there to really determine whether you're low means or you're going to be an accommodation, required to pay an accommodation payment or a RAD, refundable accommodation deposit, towards the cost of that accommodation. So the maximum accommodation supplement, as at 1 July this year, is $69.79 per day. If the resident's means tested amount is $0 according to the formula, they will be what we call 100% concessional or supported resident. That means that from a contribution perspective, the government will fully subsidise the cost of the accommodation. If, however, they're still sitting between $0 a day as the answer and between 0 and $69.79 per day, they will be asked to make a partial contribution towards their accommodation cost. Please note they're not a RAD payer, they're known as a RAC payer, refundable accommodation contribution. So this part can be quite confusing, but really all it is once you pump through the means tested amount, compare it to the maximum accommodation supplement, you will be assessed as either a concessional resident or a market payer. The way the formula works is it says, look, if you've got a home and no one's living in it, the home is assessed at a capped rate of about $206,000. That results in the means tested amount being above $69.79 or just on $69.79. So what that means is they will automatically fall into a RAD payer territory. So that's a really quick trick up your sleeve to work out, well, are they going to need to pay the RAD or not? If they have a home and it's not occupied by a protected person, which we'll go through in a second, then they will be a RAD payer. Now, when it comes to being 100% concessional or supported resident, what that means is your contribution towards the accommodation could be anywhere between $0 and $69 per day. If, for example, you start off as a 100% concessional resident. Now, I'm going to talk through an example in this one to help you understand where I'm coming from. So if there's a home and there's a couple. Husband moves into care, wife continues to live at home. Husband doesn't have any assets outside of the home. He will be assessed as moving into residential care as a 100% concessional or a government-supported resident. What that really means is, okay, he's going to still have to pay one of the fees, but he won't have to pay the accommodation, anything towards the accommodation costs today. But eventually, if the spouse at home, so that if the wife becomes ill and needs further care, again, she moves out into a residential care home, or in another case, if she's no longer here, if she passes on, then the home is vacant. What happens then is the value of the home gets counted towards the resident's assets, and therefore we add on $206,000, which is a capped value of the home, to the resident's asset pool. And what happens is this $0 a day that they're paying towards their accommodation cost increases. That's known as the daily accommodation contribution, and that will increase over time. All of a sudden, they may also need to pay a means tested care fee, which we'll get into in a second. As you can see, it is a little bit complex, but once you understand that there's two ways to move into care, concessional or a RAD payer. Concessional can never become a RAD payer, even if they come into $1 million or win the lotto. They're not going to suddenly be moved over to a RAD payer territory. A RAD payer can never move into a concessional supported resident territory. They are separate. Where it changes is from a concessional resident to a part concessional resident. So they'll toggle between the two depending on their means. Just check the time. Oh, okay, resident, I've got 15 minutes or a little bit longer. So here's the means tested amount, 50% of the income plus the asset amount, 17.5% of the assets up to a certain threshold, and that's where the means tested amount comes in. You're welcome to have a fiddle around with it later on once those slides hit your inbox later on. Now the current rules, I'll run through the fees. Basic daily care fee, about $63 a day. That's set at 85% of the single basic rate of age pension. There's the accommodation payment, known as the RAD. So if you see an advertised room cost of $550,000, that's the refundable accommodation deposit in current system. in the current system. If you don't have the means to pay the full 550,000 or even a part towards it, any outstanding amount you pay interest on. The current rate is 7.78% in July. When you move into care as a permanent resident, so please note this is not moving into care as a respite, but moving into care as a permanent resident, then what will happen is you will be locked in to whatever this interest rate is, known as the maximum permissible interest rate. You will be locked in as at that permanent entry date, whatever the rate is. That rate's going to fluctuate over time, but you're still locked in to that particular rate. And you pay interest on the outstanding amount in relation to the refundable accommodation deposit. So if you pay 200,000 towards the RAD, 350,000 is outstanding, and you'll pay interest on that at a daily amount, 7.78%. If you are low means, on the other hand, as we spoke about earlier, you'd be required to pay, if any, a daily accommodation contribution, which can be converted into a lump sum, known as a refundable accommodation contribution. Now, currently there's this means tested care fee. So the forms to do with Services Australia is all about this means tested care fee. And the forms seem quite simple, but there are some traps in there. We want to make sure that we're not actually filling in the form incorrectly, so the resident doesn't get assessed as a RAD payer when they should be a concessional resident, or vice versa. We want to make sure that the income is correctly input. We want to make sure the assets are correctly input. So please assist them with this process if there's a family member that is looking to place a loved one into care. Otherwise, please reach out to an accredited aged care financial advisor. So now the means tested care fee, if you don't provide any information to Services Australia, and some wealthy individuals will choose not to do, a letter will come out from Services Australia saying we haven't received any information. Your assessment has come out at $406 per day for the means tested care fee. Now, we all balk at that, but these are currently capped. As of the 20th of March, they're currently capped at about 34,311, and I believe these are current rates as well, and then 82,000 for their lifetime cap. And remember, any income tested fee is counted towards this lifetime cap. So we've gone through, they've got to pay a basic daily care fee, the cost of the room, the DAP or the RAD or the DAC or the RAC, the means tested care fee, and that can change every quarter depending on the means and how things change, and the additional services fee, which are really for luxuries in aged care, which can be wine with your meals or foxtel. And these additional services in Sydney, where I'm based, is that can be, it's not an option. It tends to be you come into our care home, we provide these extra services, and there's an additional cost for that. Not every care home will charge it, but most do. Now, there's always a question about, hey, how's my former home going to be assessed? So from an age pension perspective, so please note you're always wearing two hats when you're looking at residential aged care and the potential move into care. One is what's going to happen to my age pension, and the other one is what's going to happen to my aged care fees today and in future. So from an age pension perspective, the former home of the resident that's moved into care, it's actually exempt for 2 years from permanent entry into care. So if someone moves in today into residential aged care, from an age pension perspective, their home is vacant, but they're not going to assess that for 2 years because of this nice exemption. If it is a couple and one person is at home and the other one moves into residential aged care, the spouse that's living at home, from the time they are no longer at home, that's when the 2-year exemption starts. Now, I've made a note there that from an age pension perspective, when you are illness separated and one individual of a couple, so one spouse moves into residential aged care and the other one continues to live at home, they will be assessed at illness separated rates, which effectively means eligible to receive the single basic rate of age pension. From an aged care fee perspective, the home, as I mentioned earlier, is capped at this $206,000 amount. The former home, if the former home is occupied but by a particular individual that falls under this banner of what we call a protected person, the home is actually not going to be assessed until that protected person is no longer occupying that home. When that time comes, the home will be assessed at its capped value of $206,000. Remember, it's for aged care fee purposes. Now, a protected person, that can be a spouse, it can be a dependent child that's under 16, a full-time student. Now, I have come across where this has been a grandchild living with his elderly grandparents and assisting them. They had come from further away, so this situation worked out. Now, if someone is a carer and they're eligible for an income support payment, not an allowance, but a payment, for example, a carer's payment, and has been living in the home for the past 2 years, they would be classed as a carer that's eligible. However, what we do see is a lot of people still working. They're looking after their parents, they're looking after their own families, but they are receiving an income support, but it's an income support allowance or carer's allowance. So it doesn't quite fit the criteria, unfortunately. There's no protected person in the home. Another way we can apply this protected home status to someone is to look at, okay, is there a close relative that's living at home? Are they receiving an income support payment? And have they been living in the home for 5 years? So there's a few options that we can look at. So please reach out again, and the My Aged Care site does have this information in there that you can look on as well. So that was, sorry, I did miss a page. Okay, here we go. Then I said I'll talk about going through the options. So the options are you going to be a low means person when you move into residential aged care, or are you going to be assessed as a market payer? The DAC and the RAC, as I said, if someone is assessed as a low means resident, that can vary due to their means. And the means test of care fee can change as well. The options, and from an advice perspective, we want to inform the family or inform the resident or the person that's assisting them in making this decision. In terms of affordability, we want to make sure that they can afford moving into care today, but also make sure they can afford the fees in the long term. If there's a spouse living at home, we want to make sure they can afford to continue to fund themselves and fund their living expenses as well. So what we look at is, should we pay the DAP or the renting of the room? Should we rent the accommodation? Should we pay a lump sum towards the RAD? What will that will reduce the DAP? Should we, if there's no one living at the home, should we rent the home or should we sell the home? What does that look like? A lot of people come to us saying the home's on the market, or we're talking to an agent, and you may not need to jump that far yet. Get the advice first. If it looks like that's the best option for you, sure, take it. But most of the time, families that are looking to move someone into care, they really want to hang on to the home that mum and dad probably built. They probably lived in it for more than 50 years. They want to pass this on to the kids, to the grandkids, and they're very well aware of the property house prices crisis that we're living through at the moment. So they do want to pass that on. So we do want to help them hang on to that home for as long as possible, as long as they can fund their cost in care. First priority for most families I speak to is we want to make sure mum and dad have enough to fund their care costs. They worked hard, they looked after us, we want to make sure they've got enough. And then secondary, yeah, we'll think about whatever's coming through later on. It is a secondary for a lot of families that do opt in to get some advice. I've mentioned family contributions there. So some people will say, hey, I'm doing okay. I'm going to pay for the cost of the RAD for dad who's moving into care. If that's the case, what they've effectively done, all with really good intentions, but what they've effectively done is given mum and dad more assets in their pool. So what will happen? Dad will automatically get assessed as a RAD payer. He will also have a higher means tested care fee based on the contribution that's given from the family. If a family says, I want to gift some money to the children, we have to consider gifting rules and how that affects the age pension. So there's lots and lots of options. There's more options than what I've noted there, but I'll keep it high level for this webinar at this stage. So I hope I gave you some insights into the current system. And if you think that's complex, let's move in to the upcoming reforms, residential aged care upcoming reforms. So the basic daily fee, what's going to change here is we're going to move from just paying the basic daily care fee. Residents will continue to pay that, but they'll also be asked to pay a hotelling contribution. So what that is, it's a means tested hotelling contribution. Based on your means, people will be asked to pay up to $12.55 per day at the moment. And look, things can change between now and November, so please keep this as high level information up your sleeve and reach out if needed. Proposed accommodation changes. So we've got the RAD or the RAC. So you may have heard of this already, but the approved cap for the accommodation payments. So when providers are building new care homes and they're these nice high rises that are coming through and they feel like a hotel when you walk in, they no longer need pricing commissioner approval for any room above 550, which it used to be. From 1 January this year, accommodations, the approved cap is already set at 750,000 from the 1st of January. So if you want to charge a higher room price for your new rooms that you're offering to residents, then you would need pricing commissioner approval for any room that costs above the $750,000 mark. Okay, so you may have also heard that a portion of the RAD, so the refundable accommodation deposit in the current system says it's refundable 100% when the resident leaves a care home. The new system says we'll take the refundable deposit that you're willing to pay, and we're going to retain 2% every year as a non-refundable amount, and that's going to be deducted from the refundable accommodation deposit. It's only applied over the first 5 years, so a maximum of 10% retention amount. They're not really expected to increase the DAP payments, but we are still to have confirmation around that. And this is really the reason that a lot of the system got pushed out, because providers and care homes need to get their systems up to speed to be able to keep up with these changes, which is not a one-off change, they're continuous changes over time. The daily accommodation payment, again, the MPIR or the interest rate will be set at permanent entry date. That will not change, but what will change is the daily accommodation currently is set at a certain amount at a certain rate. The daily accommodation payment in the new system will be indexed along with CPI. So the initial daily accommodation payment is set at entry date, and then it will be indexed along with CPI. According to what I've read, it is calculated daily, but not to be deducted more than once a month. However, there's no confirmation around that. These are the little tweaks and complexities that we're waiting for clarification around. Residents will continue to have a choice to pay either the RAD or the DAP, but they'll need to decide within the first, they will no longer need to decide within the first 28-day period. Current system says they do need to decide within the first 28 days, but it's not enforced. But it's definitely encouraged by the care home staff. The new system says, don't worry about that. We'll just figure it out. Otherwise, until that time, you pay the DAP. There is talk of potential elimination of RADs altogether from 2035. I haven't seen too much detail around that, so I'm going to say it's to be confirmed. I don't know how that would work. So at this stage, we're going to say to be confirmed. Now, in the reforms, there's a proposed non-clinical care contribution. So the clinical care is going to be fully funded by the government. That's a big plus. That's a good thing. However, the non-clinical care, a new means-tested system is going to come in to assess how much a resident will pay or contribute towards their non-clinical care costs. It can be up to about $101.16 per day, and that will be indexed over time. There's a certain percentage of assets, a certain percentage of income that's put through a formula, and then there's your daily cap. You'll notice that the old annual and lifetime limits are going, and the lifetime cap is going to be applicable in the first 4 years, where the cap is 130,000. That will be indexed over time. So a lifetime cap to limit payments for the non-clinical care contribution is going to come into play. $130,000 cap over the first 4 years, and after that it will drop off. And then there's also going to be a proposed higher everyday living fee. So residents this will replace the extra services or additional services fee that I mentioned earlier. The higher everyday living fee is where residents will actually have the opportunity to review the options, see whether they do want to accept and pay that additional daily fee. Some residents, it will be very important for them to take on those services, but for others, they may not drink the wine. It may not be a service they want to opt in for. They may not want a particular activity. So it's really to assist people who are able to utilise the services to opt in to those services. And that is an agreement that's going to be coming through from 1 November. All right, so I've come through to the end of the slides. So I will take any questions if I can work this out. But I do see actually we're right on 12 o'clock and 1:04. So what we'll do is, firstly, I just want to thank you all for your time. I know that was a lot of content. Please reach out with questions. When I receive those questions, I'll reach back out to you and we can have a conversation or an email response around that. But look, I do thank you for your time, and yeah, that was a lot of information, so feel free to reach out. I'll just let you know the next Wealth Space webinar, which Kelly Kennedy will run, is going to be around investment properties on the 3rd of September, similar time, and we'll make sure that technology is working on the day. And Alina McCarroll will be joining Kelly as well. If you'd like to subscribe, please hit the subscribe button and come in and see the latest information and the events that are upcoming. And the insights will be directed to your inbox, your emails. Thank you all very much. Bye-bye.